Hello, welcome back to the channel. I appreciate you being here. Please make sure to stay till the end so you can hear all the sources and verify the news for yourself. Now, let's get into it. In a development that's stirring public debate across South Africa, ActionSA has come forward with sharp criticism against the Department of Health, saying they've overlooked a serious issue: how public healthcare is being strained by the growing number of undocumented foreign nationals using the system. This came to light following comments made by Health Minister Joe Fowler, who earlier said that while the department doesn't track the nationalities of patients, it does uphold the Constitution by treating anyone in need. But ActionSA isn't buying that approach. According to them, the department's lack of documentation on the scale of foreign nationals using healthcare facilities is not just a blind spot, it's an outright failure to manage the system properly. They argue that without knowing the numbers, how can government plan budgets, allocate resources, or even begin to understand what's going on inside clinics and hospitals across the country? For ordinary South Africans, especially those who rely on public health care, this hits close to home. Long queues, staff shortages, medicine stockouts, and overcrowded emergency rooms are all too common. Many people say they've had to wait hours, sometimes even days, just to be attended to. And when you throw undocumented foreigners into the mix, some of whom cross the border just for medical care, it's no surprise that frustrations are rising. ActionSA President Herman Mashaba, who's never been shy about his views on illegal immigration, said it's unacceptable that the department is not monitoring the impact of foreign nationals on state services. He called it an abdication of responsibility and a disservice to South Africans who've paid into the system and expect some level of prioritization. Mashaba added that it's not about xenophobia but about accountability and good governance. He believes the lack of data creates the perfect environment for corruption and inefficiency. Without a clear picture of who's using what, there's no way to properly fix the issues. Now, to be fair, the Constitution is very clear. No one in South Africa can be denied emergency medical treatment, regardless of nationality or documentation. But ActionSA is not asking for anyone to be turned away at death's door. They are asking for structure, tracking, and transparency. What this shows is the ongoing tension between humanitarian values and the practical realities on the ground. Nurses and doctors have to treat whoever comes through the doors. They don't get to ask for IDs in life-or-death situations. But when hospital beds are full, when local patients can't get surgery dates, and when there's barely enough medicine to go around, people start asking hard questions. ActionSA is pushing for national government to take this issue seriously by collecting data and creating policies that reflect the strain the system is under. They've even suggested that government begin negotiating with neighboring countries about healthcare arrangements, so South Africa doesn't carry the load alone. Some citizens have also weighed in on social media, saying it's time to prioritize South Africans who already face deep challenges when accessing quality care. Others argue that foreign nationals are being unfairly blamed for a system that's been failing for years due to poor management and underfunding. It's a complex issue, and one that doesn't have a simple answer. But one thing is clear: South Africans are tired of feeling like they come last in their own country, especially when it comes to essential services. As this debate continues, ActionSA says it will keep pressing for change and for honest conversations. Whether government will respond with solid data or continue defending a policy of non-tracking remains to be seen. But for now, the cracks in the healthcare system are becoming harder to ignore. And the longer these issues go unaddressed, the more ordinary citizens will feel the weight, whether it's at the clinic, the pharmacy, or the hospital entrance. Thank you for listening till the end. Remember, all images used are for illustration purposes only.